Africa's women are among its greatest natural resources. African women are builders, teachers, farmers, healthcare workers, producers, professionals. They are our mothers, sisters, daughters, and wives. Every day, Africa loses more of this precious human resource, prematurely and unnecessarily. In most African countries, women who experience unwanted sex, unsafe sex, and unwanted pregnancy have but one option: unsafe abortion. With every passing hour, nearly 500 African women risk their lives to terminate unwanted pregnancies. When properly performed, abortion is one of the safest of all medical procedures. Yet every day, about 90 African women die from unsafe abortion, at least one woman in each of our 54 countries. These deaths and countless related injuries of women are violations of women's human rights, including the right to adequate health care, the right to decide whether and when to bear children, the right to self-determination. When women are unable to participate fully in society because they are denied basic human rights, everyone suffers. Every year, deaths and injuries from unsafe abortion, which are preventable, cost African economies countless hours in lost productivity. And each year, African health systems spend vast amounts of money to treat complications of unsafe abortion. A woman's decision to terminate an unwanted pregnancy is not made solely in her own interest, but often in the best interests of her children and her family. Similarly, women's deaths from unsafe abortion are not just women's problems. They are society's problem. They are our problem. The international health community, including governments, health systems, health care providers, NGOs, and donors, agrees that African women's lives are worth saving. And in every Africa country, abortion is legal under certain circumstances. We have the power to prevent deaths and injuries from unsafe abortion. We have the knowledge, the technology, and the resources to save women's lives. We have the duty and often the legal obligation. Why then are African women needlessly dying? Because we lack the personal and political commitment to end unsafe abortion. Will we make that commitment? Everyone has a role to play in saving women's lives. everyone can make a difference. We must accept our individual and collective responsibilities. We must act now. If you are a health care provider, you can use international guidance to improve reproductive health care, train other providers in safe abortion care. If you are a health policymaker, you can establish clear standards for legal abortion care, make services affordable and accessible. If you are a lawmaker or government official, you can know and uphold your country's global commitments, clarify legal grounds for abortion. If you are a legal expert, you can identify legal barriers that prevent women from accessing safe abortion, help draft abortion laws that support women's rights. If you are a women's health activist, you can review your government's compliance with international agreements, educate women about the dangers of unsafe abortion and the availability of legal abortion in your country. If you are a donor, you can invest in efforts to increase women's access to safe abortion care, encourage other donors to direct resources to this neglected issue. Now we must come together. Everyone can make a difference. Will we make that difference? Will you? Are our wives, daughters, our girl children's and sisters' lives worth saving? Can African women, families and communities count on us?